Hey guys, Dr. Justin Marcagiani here. Today we're going to be talking about throat burning. Why is your throat burning? Why are you waking up with it burning? We're going to differentiate throat burning issues and acid reflux. We'll dive into it and we'll talk about the functional medicine principles and root causes that are at play here. All right, if you enjoyed today's video, please give me a thumbs up. I appreciate it. And I'd love to see your comments down below. We'll be definitely answering those as well. All right, so I'm going to put a screen up here so you guys can follow along with some of the outline that I created here before. Hopefully it makes a little bit of sense. All right, so first big thing out of the gate, when we have throat burning, one of the big things we see is LPR. That's known as silent reflux. So with silent reflux, we have two sphincters. We have a sphincter in our throat and we have our sphincter at the lower esophageal sphincter, okay? And these two sphincters stay closed on average, and then all of the contents stay in the stomach when we eat, right? That's healthy digestion. So even if we go horizontal, that's going to stay in the stomach. Even if we're upright, it's not going to reflux up. It's not going to irritate our throat or our lower esophagus and give us that gastritis feeling. That's healthy physiology. Sphincter 1 by the throat close, sphincter 2 here by the stomach close. Now, when we have chronic inflammation, though, those sphincters can start to open. So when we start to have that lower esophageal sphincter open up, that's where we can have the gastritis, the heartburn, those type of issues come at play where you feel that heartburn. It's deep, it's right here. And then when it starts to go up into the throat, for LPR to be present, LPR has to have that throat sphincter opened up as well, where it can go to the throat. Now, in general, for LPR to be present at all, that lower esophageal sphincter has to be open, because the only way it gets from the stomach is it has to go through gate number 1. That's the lower esophageal sphincter to gate number 2. So if gate number 2 is being impacted up here, but there's no symptoms down here, this tissue and more in the stomach area, right? It's more tough. It's a little bit more thick and meaty. Where the tissue in the throat, the vocal cords and everything, it's going to be a lot more sensitive mucosal tissue. So it's possible that you could have a LPR issue, throat irritation issue, and not a lower esophageal sphincter issue just because that tissue is tougher. But by definition, there has to be a problem with this lower sphincter for this upper one to be impacted, because everything has to go through gate number 1 to get to number 2. Hope that makes sense. That's just kind of like physiology 101. Once you get that, then that's like foundational. Okay, good. So big things out of the gate. So LPR, right? Acid or pepsin reaches the throat without classic heartburn, right? So this is going to be where that lower esophageal tissue is in good shape, right? Throat tissues are more sensitive than the esophagus. The big things we're going to see are sore throat, hoarseness, cough, sometimes post-nasal issues as well, burning and waking. A lot of times post-nasal can be from actual food allergens too. So that's why I always recommend out of the gate, do a really good sinus flush to make sure you're getting any junk or any mucus out of the back of your throat, because sometimes that can easily drip down and create that throat issue too. So we'll do Xlear spray, then we'll do a 3-second saline flush with good clean RO or distilled water or really good filtered water up each nose. May even add a drop of iodine in there. I have a really good video on that topic at the end. We'll put it either here or here for you to see. So that's a good option for you. All right, let me keep on rolling for you guys. And if you like the content like this, there's a lot of complicated topics I address, so I just want to make sure you guys can follow. If you like it, please let me know in the comments down below. All right, so we talked about LPR. That's more the throat. Again, for the throat to be involved, the lower esophageal sphincter also has to be involved too. So that's really important out of the gate. And then I'm going to just check one thing out. And I'll see if I can just find a picture here for you guys on the spot that would maybe be helpful for you. Here's a good one for you. Here's a really good one for you. Just keep it simple. I'll pull this up for you guys too. Hopefully you like it and you enjoy it. All right, very good. Let me know if you guys can see this. Excellent. So big thing I wanted to highlight here is this. So you have your upper esophageal sphincter right here, and then you have your lower esophageal right with the stomach. This is the fundus here, right when it's here. That's your lower. So LES and UES. So I hope that makes sense, guys. Hope that makes sense. All right, good. And so when we talk about the things that are irritating it, right, why is that lower esophageal sphincter irritated? Why? What's the underlying cause of that? That's Really key. We always want to get to the root cause when we're talking about things. So number one is not having enough stomach acid. I rail on this all the time, right? So you're going to see here out of the gate, not enough stomach acid. That's a big one. When that happens, it starts to allow the environment, microbes to overgrow. Stomach acid is antimicrobial, so it starts to inhibit bacterial overgrowth when stomach acid is high. And when it starts to drop, then bacteria can start to have a feeding frenzy. That's a big deal too. People often mistake it for high acid, but it's not. Usually what's happening is the acid also triggers the esophageal sphincter to close. So when you have digestion happening, you make this hormone called, or this kind of peptide called gastrin, that triggers acidity. It also triggers the esophageal sphincter, the LES, to close. When it doesn't close, that's where that acid can rise up. And also, if we don't have enough acid, what also tends to happen is we have fermentation and rotting happening of the food. And that rotting of the food creates its own organic acids, and those acids rise up and can burn the throat. That's actually a really big deal. That's common. Now with GERD, maybe silent, but still allow acid in the throat. So we have the lower esophageal sphincter. That's when GERD happens. LES dysfunction is often the starting point for both GERD and LPR, right? Because this is gate number one. So I mentioned LES, that's lower esophageal sphincter. That's gate number one, like I mentioned in that picture. And the esophagus may not be inflamed enough to feel it, okay? Meaning the lower esophagus, it just may not be inflamed. That skin's tougher, right? And you can develop what's called Barrett's esophagus over time, where that esophagus is going to be more squamous tissue, and it almost kind of starts to develop a callus, and you get what are known as columnar cells. So think of that as like a callus forming at the lower part of the esophagus. That's known as a Barrett's esophagus, where there's chronic inflammation. Hiatal hernia is a big deal. Let's go into hiatal hernia. So first off, if here's your diaphragm, so if here's our stomach right here, here's our diaphragm, and then our lungs are right on top of that. So we have diaphragm, we have stomach, and then we have this esophagus right here. And so what a hiatal hernia is the stomach starts to peak above the diaphragm, and it can kind of pinch it off a little bit too. And so that rising up of the stomach above the diaphragm, that's a hiatal hernia. And I've seen it time and time again. When the stomach is inflamed, that tissue kind of retracts and recoils. It's kind of like if you hurt your wrist, or your elbow, you'd be like this. Like you're not going to be like nice and loose and relaxed. You're probably going to be guarded, right? That same thing is happening to your esophagus. It kind of retracts up and it can pull that stomach up along with it. So I see lots of people, they recommend surgeries and things like that are more invasive. So first off, you can do a technique where you lift your elbows up, and that raises your esophagus up as well. And it also raises your stomach. You go on your tippy toes, and then you fall back, and then you bring your elbows down. Basically, it's just taking if here's your esophagus, you're just kind of flicking it down a little bit and allowing that stomach to come down. That's all it is. You're kind of just flicking it. Or as a chiro, you could deep breath in, you get your fingers right under that diaphragm area, and then as they breathe out, the diaphragm comes up. And so as it comes up, you're kind of tractioning it down as it comes up. So that's kind of the philosophy there. If you're seeing an osteopath or a chiro, you can do manual manipulation, or you can do and then drop it. So that can help kind of manually move it. But in the end, what's the solution? Get the inflammation down. If you get the inflammation down, that tissue's going to relax. Just like if you had a shoulder or elbow, start to heal it, get the inflammation better, and now it starts to fall in the right place. So just kind of remember that philosophically. All right, let's keep on rolling. So hiatal hernia, that allows upward movement of the stomach contents, especially when laying flat. So now it's going to be harder for things to drain from the esophagus into the stomach. And so when you go flat, things are going to come upwards a lot more. So left side sleeping can be helpful. Also head elevation. So we'll recommend like an acid reflux pillow, like a 15-degree wedge pillow. That's like a foam one, or you can use some pillows to prop it up, or you can get some bed risers under the back 2 legs of your bed and just prop it up 15 degrees. That can be helpful just to allow gravity to empty things better. What we'll also do is we will try to make sure the patients don't do any big meals before bed. Try to make sure we do at least 3 hours. And maybe we go a little bit lower on the acid and make it an easier to digest meal at nighttime. That's another big thing that we'll do to help improve the inflammation and make the food easier to digest and empty. We'll also add in things like bitters. Bitters can be super helpful because they trigger that MMS, migrating motor complex. which then allows food to empty into the stomach better. And again, of course, having enough acidity is a big trigger for that, is really important. But if someone has gastritis, they may not be able to handle acid. So then we're going to use bitters and maybe enzymes, and just use things to make the digestion very easy to handle and not create inflammation. And then using gravity to help us. So we may use that wedge pillow to allow the contents to move down. Big thing is infections, H. pylori, SIBO. These can disrupt motility. They can lower acids. They can increase fermentation. They can increase pressure. They can increase gas. They can cause more reflux because the microbes are creating inflammation. They're messing up the gases. They can create the stomach distension. It can start to increase the hiatal hernia as well. So all those things can be at play and can be problematic too. Big triggers. What are the triggers? Gluten, dairy, alcohol, spicy foods, sometimes even healthier foods like eggs, and even nuts and seeds can be a problem sometimes. Every now and then I see nightshades can be a big issue, especially with acid reflux or GERD. Coffee can be a big one with some as well. And again, not chewing the food enough or not cooking it enough or doing a lot of raw foods, a lot of big raw salads can be a problem. Definitely can be. And then we talk about post-nasal drip too, and from an environmental standpoint, mold, dust, but mold can be a big one. I've seen people have post-nasal drip where at night it's just dripping down the back of their throat and creating some issues and some burning. So if you're waking up with throat issues, you definitely want to be gargling saline at bedtime, flushing your sinuses out, and get that wedge pillow going to at least help give gravity a little bit more favor so things don't get inflamed at night. Now, big things, what are the big stressors? What's going on here? So again, poor digestion. We have to fix the digestion. We're going through our 6 hours. We're removing the bad foods. We're replacing the enzymes and acids. We're going to repair the gut lining and the hormones. So that's where the adrenal dysfunction comes in. So when we have weak adrenals, that's going to increase the sympathetic tone and decrease the parasympathetic. When parasympathetic's down, we're going to have less healing, less recovery, less DHEA, less anabolic hormones. When we're stressed, we're going to be more catabolic, more breaking down. When we're catabolic and breaking down, where does the blood flow go? It goes to the extremities to run, fight, or flee. So that means you have less blood flow and less acid and enzymes where? In the stomach. And so that can create more indigestion on that side of the fence too, because we're just not breaking things down well. So hope that makes sense. We really want to get to the root cause of why there's an issue so we can actually fix the underlying issue. All right. And then again, we talked about the environmental allergy. So getting on a good adrenal protocol is going to be important. Doing all the foundational lifestyle things, right? Food, getting on a really good whole foods paleo template, following my eating plan, getting to bed before midnight, doing movement that allows you to feel good, but not beat up, right? Just foundational things. Get on all the nutrient support that we know we're missing, making sure we're dialed in on digestive support and making sure we're on a really good hormonal support plan. If we have low thyroid, address that. If we have estrogen dominance and low progesterone, address that. If we have infections, H. pylori and SIBO, maybe C. diff or E. coli or a low probiotics, we have to address that too. And again, everyone shows up a little bit differently. Haven't done this for 15 years, 5,000 plus patients, just see a lot. There's patterns, but everyone shows up a little bit different within that pattern. And so someone's issue may be low probiotics, where other one may have high probiotics, but they have a lot of dysbiotic bacteria and low acid, while this person maybe has low acid, but maybe more low bile than acid, right? So everyone shows up a little bit differently. So hope that makes sense. I hope you guys enjoyed today's video. Try to make it, succinct of why that throat burning is happening. Big things you can do: ginger tea with manuka honey, wonderful. Aloe juice, wonderful. Get the wedge pillow going, get that dialed in. Use my GI Restore, which is healing, soothing nutrients for the gut lining. Collagen peptides, wonderful. Bone broth, excellent. And then address the underlying microbes that are present. Support your digestion. Again, if your situation's complicated, it's been dealing with it for a long time, you may want to reach out to a functional medicine doctor like myself. If you need more support, there'll be a link down below where you can reach out. If you want to dive in deeper, do more testing, customize some of the approaches specific to you, there'll be a link down below where you can reach out. But it's a lot of good video info here. So start applying that and then let me know what you think. All right, if you enjoy it, give me a thumbs up, y'all. Have a great night. Take care.